Made on Zencastr.
Because Zencastr makes every stage of the podcast production and distribution processes so easy. All the details are in the description. Hello and welcome to Fit for My Age, the health and well-being podcast from Abeceda, on which we don't tell you what to think, but we do hope to make you think. I am Michael Millward, the Managing Director of Abeceda. Today, my guest is Dr. Tommy Rhee, the author of The Future of Regenerative Medicine, a subject at the moment I know nothing about, but in the next 30 minutes I hope to become an expert. Dr. Tommy is based in Orlando, Florida, a place I have visited and would visit again given the opportunity. When I do visit, I will make my travel arrangements using the Ultimate Travel Club. That is because as a member of the Ultimate Travel Club, I can access trade prices on flights, trains, holidays, hotels, all sorts of travel-related purchases. You can as well if you become a member of the Ultimate Travel Club. So I have added a link in the description with a built-in discount on membership fees. You will not regret it. Now that I have paid some bills, it is time to make an episode of Fit for My Age that will be well worth listening to, liking, downloading and subscribing to. Probably also worth telling your friends, family and work colleagues about as well. Now, hello Dr. Tommy.
Hey Michael, how you doing?
I am doing very well today, thank you very much, and I hope that you can say the same.
I'm doing great. It's just a nice Florida day here. So like anything else, we have a little rain, we have a little sunshine, normal stuff here in Florida.
Oh, we had a Florida day yesterday. It's a little bit more UK Yorkshire Dalesy now. Sort of like not warm, not cold, not dry, not wet. We never really know what it's going to be like, but we just have a lot of suitable clothing to accommodate all of the different weather types. So we're ever variable, but yeah, it is always nice in Florida.
Mm-hmm.
Could we start, please, by you explaining a little bit about what got you interested in regenerative medicine? And really, I suppose before we do that, what is regenerative medicine?
Well, regenerative medicine is just a field to take your existing tissue and to engage some type of like regrowth, growing it, just either from an injury, aging process, or just normal wear and tear. You just want to start that process of rebuilding that tissue. It can be a form of a diet, supplement, a device, stem cell therapy. It's just a generic terminology in the sense of what your existing tissue needs to do to get back to its normal state. Now,
So it is exactly what it says on the tin, sir, I suppose. A way of regenerating, restoring what you already have,
yeah.
so that you can get back to where you were, recover from an injury, recover from an illness.
Mm-hmm.
It's not about adding something in, as such as using what you have
Yeah.
in order to create a better state of health.
Your body always wants to be in a homeostasis. It wants to be like a nice equilibrium. We're always recycling and rebuilding. We want to like recycle that old cell and put new cells in there. So we have that status quo of a 1-to-1 ratio. The problem is that when you're injured or some environmental condition or really aging, you start losing that 1-to-1 ratio. You're starting to destroy more than you rebuild. And that's where it really involves with the regenerative medicine that, in my world, it's about the signaling. It's about getting that right signal to do your own process of regenerating tissue. Because our cells are sitting there dormant, waiting for some information. And because we age or injure, we lose that ability to signal. So this is the whole process, is finding out what signal and turning on your existing tissue. It's an amazing field that we're working into.
Right. I can tell by what you're saying and the way in which you're saying it that it is a bit of a passion for you. But question, how did that passion develop and what got you involved in regenerative medicine?
I guess if you want to go way back to when I was like a little kid, my dad was a surgeon, and I saw the way he was responding to his patients, and it was innately brought into me to do that type of like relationship with my patients. But I was also an active person, so I wanted to get sports. So because of that, I married the two together, and I became a sports science, sports doctor, sports chiropractor. And that led me to like professional athletes working at UCLA, then the professional world, Olympians, and just that high caliber athletes. One of the major components with athletes is to recover from an injury, recover from a workout, recover from a game. And that recovery is important. You got to speed it up. So I would see everything where it started off in the world of like prolotherapy, then PRP, then where it's at now, stem cell therapy. It's just to regenerate yourself back to normal so you can do the next event, game, workout. So because of that, that's how I got involved with this stuff. This is back in 2007, 8 when I first was introduced to this world. And because of that, I introduced it to my office. And it was always about just getting these athletes' tissues back to normal. So then, once you start hearing the pluses and the great success in this regenerative medicine stem cell therapy, you start recognizing, well, there's a downfall with this. And that downfall is injectables and the cost. Now, when you do an injection, the problem with injecting the area is that you're looking at something that you have a primary injury, and then now, because of that needle going into that tissue, you made a secondary injury. So, a lot of athletes would complain about they can't do this type of therapy during the season. It was like an off season therapy. So, there was that void right there. It's like, well, how do I get regenerative medicine during the season, the stem cell therapy during the season? Because they would benefit with that. So then you look at different delivery mechanisms. If it's injectables, of course, then you look at other devices. There's nasal sprays, there's all kinds of things. But then you start thinking about what's really going on. And when you find an understanding of the mechanism of this whole stem cell therapy and the signaling, well, then you understand, okay, the molecule is not as big as a cell, it's a smaller cell. And then now you can use an application for a topical, application to go on top of your skin, drive it through the skin to the damaged tissue. So that's how I evolved all the way to where I'm at right now, where I developed a topical stem cell cream. And then from there, it's about really applying it and understanding it. And then from there, educating people. That's the hardest part right now. And that's why I'm doing shows like this, just to educate people that there's a different delivery mechanism to get these type of signals from stem cells to your existing tissues to say, turn on, regenerate, get that signal to say, grow.
I appreciate you being guest on Fit for My Age and helping with the health education and health awareness of people. It's one of the reasons why we set Fit for My Age up. We do appreciate your involvement and support. But if I can be honest about my level of knowledge on this subject, which is zero, and you're talking about stem cells, and the stem cells you're saying are the ones that need to know whether they need to switch on or switch off. The treatment that you've devised is one that tells the stem cell that it needs to switch on.
Yeah, you got to think about what you're trying to do. You have a damaged tissue or something that's not growing, it's not doing its job. And then you think about, all right, so why isn't it doing its proper job of either going through mitosis, cell division, or you want to go ahead and make those type of like those collagen fibers? Well, there is an adult stem cell in our body that sets the cascades going. So that adult stem cell in our body has a mechanism to say, do your job. But there's also the step, there's a preliminary step that you have to tell that particular adult stem cell to do its job. Well, that's a signal. You have to get that signal to engage into that adult stem cells to do its job. For instance, in the muscle, there's a thing called a satellite cell. That satellite cell is the stem cell for the muscles. That's the precursor into the myosin and the fibrin and all those kind of little cells that make the contraction of the muscle go back and forth. When you damage the tissue, you have to start that signal. You have to find out how to turn on that satellite cell to make its little baby daughter cells and then also go down to the process of healing that tissue. When you don't have that signal, now you're saying, all right, there's nothing going to turn that satellite cell to do its job. So that's why you need a donor site that comes from another tissue that has that information or that signal to tell the adult stem cell satellite cells to do its job. Like I said, as we age, we lose that ability to signal. Our signals become less and less like strong and bright. So, but when you take a site that's from, let's say, an umbilical cord that has the ability to have a strong, bright, immature signal, well, now you introduce it to our body and then it goes to the satellite cell and it says, do your job. And that's what that's all about, is a signal. The signal you're trying to get from another site to your tissue and do its job.
A real world real life example of this was that I was in the gym a couple of weeks ago. I was attempting my personal best at a deadlift, and I did manage to lift the weight. That was not the problem. I did lift the weight, but I got my technique a little bit wrong. And as a result of that, wasn't the fact the weight was too heavy, it wasn't. I lifted it. It was getting the technique wrong. My back hurt like hell. Really, really painful. So one of the things that we did was we put an ice pack onto where the pain was. And then I used like a heat gel as well. So we cooled it all down. Then the trainer said if you then put some, like a heat patch or some heat gel on the same area, that will tell the white blood cells to go to that part of your body and start doing their work. That's the same sort of thing as you're talking about with the switching on of those stem cells. There is a process that the body goes through when it is injured, and every cell, like you say, wants to be the best version of itself that it can be, but it needs to be told that now is the time to be the best version. So you use a stem cell cream in order to activate the cells that then tell those stem cells to get moving and do their job.
Yeah, it's almost like if you think about if you have a cell, like you're on a cell call, right, a mobile phone, and you lose the signal. Well, because the signal is you probably in a bad area or it's not strong enough to get to the actual receiver, you drop your call. You need the strong signal to receive that information or that call, and then you can have communication. And that's what it is. It's all about getting that right type of channel to get that signal to your body. And that pathway is important. So, when you have that back pain, you want to, the trainer gave you ice to vasoconstrict. You want to stop the inflammatory process. When you look at your back, there's so many integral parts in your lumbar, your low back, right? You're just not only looking at the vertebrae, the disc, the vertebrae, but there's little like joints called the facet joints. And these little joints have little areas where they have this sac called the synovial sac, and there's fluid in there. And it has its own proper type of like viscosity in that joint. When you exceed that fluid, it starts expanding out. Well, when you expand that fluid out, you're putting more pressure. When you expand that synovial sac out, now you're touching these nerve endings. Now when you touch these nerve endings, that's elicit the pain. And now you're in that world of pain. That's why you want to vasoconstrict the area. The vasal, the heat which you did is the vasodilator. You want to bring all that building blocks into your body. These are like signals. So think about if you want to compare it to what stem cells or messages, think about not having the ability to have the ice pack or the heat pack and just let your body try to do its own type of tasking. It gets confused. So you are kind of commanding of what the body should do.
You explain it in such a straightforward way. It's like, yeah, why didn't I know? Why did I think it would be overcomplicated? It's not. What you're saying is just understand our bodies. And if we understand our bodies and do the right things with the right type of resources, then we can recover from injuries much quicker than if we did nothing, which is common sense, I suppose.
Yeah.
I'm wondering if there is anything that we can do that supports the process. So is it like different types of food, different types of exercise, different types of... What are the things that once we visit someone like yourself, we get put on this program of treatment, what are the sorts of things that we can do to help that treatment be more effective?
Well, if you're asking for like an adjunctive or an ancillary type of therapy along with, this type of regen application, one of the big things that you have to understand is that you have to increase vasodilation or some type of capacity to allow fluid to go through. One of our worst enemies is some type of like occlusion or some type of restriction, either our nerves or vessels, anything. We don't want that arteriosclerosis, that plaquing in our vessels. You don't want the hardening of the vessels. You want natural fluid dilation, constricting, playable back and forth, yin and yang, plus and minus. You want that. So when you do regen, one of the biggest components you need to really understand for living that longevity and that excess of 50, 70, 100 years, it's exercise. You have to have that ability to exercise. But the problem with exercise is that if you don't have the ability to recover from an activity, you're now going down that cascade of that chronic pain. And when the chronic pain sets in, now you're being like that non-productive, non-exercising mode. So you need to stay in a balance between working out and recovering. Now, when you recover is longer because you're an older person, well, you have to figure out a faster way to recover, a faster method. And that's where you have to think shortening that distance between, you know, a workout and resting 3 days. Maybe now it's 5 days, maybe it's 7 days. You got to speed that process up by a mechanism of regenerative medicine, nutrition, anything that has to do with exercising and having your body keep moving. You need that push, pull, up, down, that yin and yang, and more importantly, that, you know, breaking down tissue and rebuilding it. So I feel that when you start doing any regenerative medicine activity, you have to get moving. There's a lot of devices out there that helps you move, but you just have to remember you need to get that compression in your body and then the ability to recover from that compression.
Yes. Back in 2012, I was involved in a car accident where someone drove into the back of me. I think Americans would call it being rear-ended.
Mm-hmm.
As a result of that, I ended up seeing a physiotherapist. But one of the things it did was to get me back into being more physically active. That was one of the things that the doctor and the physiotherapist recommended as a good contribution to making sure that I would recover faster. So that was 2012. That happened. Then in 2018, it happened again. And although the car was written off as a result of that, I walked away from the incident because somebody rear-ended me. I ended up going back to the same physiotherapist who told me exactly really what you've just told me, is that because I had been physically active in those 6 years in between the accidents, he could tell that my body was actually recovering quicker than it had done following the first accident. It was purely down to the fact that my body as a whole was fitter. I was eating differently, I was exercising more, I was sleeping better, and that helped my being, well, the exercise, the diet, nutrition, sleep, all helped my body recover from the trauma of being in that second car accident. You're putting an awful lot of sense into my lived experience in lots of ways, Dr. Tommy, which is like quite enlightening and reassuring at the same time. But we still have this issue of aging, and we all hopefully get older, but as we get older, we are, essentially less capable of the sort of physical activity we tried and were able to do in our 20s, so to speak. So if the aging process means that we are less likely to be able to do things, how does the stem cell treatments that you're talking about impact the aging process?
Okay. So one of the major ingredients that we just mentioned was exercise. It could be the long walk. It can be weight training. Any type of loaded scenario that you need that. So when you do an exercise, you do break down a little bit of tissue, and then the goal is to break down tissue, rebuild it so it gets bigger, better, stronger. Now the recovery we mentioned is delayed because our signal is not there. What regen does, it actually increases that signal so then you recover faster. So then you can get back in activity. It's always about being active, pushing yourself to a point where you're fatiguing, you're breaking down little tissue. It grows back bigger, stronger, so you don't go through sarcopenia. You go through a thing like muscle building. When you go through muscle building, it's about that regeneration. Now you're having the ability to do that tasking of being active. And then when you do activity, there goes your circulation doing better. You're getting that vasodilation. You're getting releasing of that nitric oxide to open the vessels up. You're doing everything what your body should do during a normal activity. So that's why exercise is important. And then you have to find a way to increase the exercise by using that recovery method that we talked about, is that topical regen. So that's why I always say that aging is a process that we have to deal with. But if you can just think about recovering from a walk, so then you can stay with that every other day walk or everyday walk. Then you think about maybe you sprain your ankle that may restrict you. Well, that may set you back a week or two. But if you can quickly recover from that faster, well, you're back to your activity. It's always about getting back to your status quo, getting to that point where you can become that person. So you don't have that delayed recovery, delayed going back to your exercise. You want to stay active. And that's the secret. That longevity is that secret. Exercise. Stay in that routine.
Yeah, exercise, exercise, exercise. It's vitally important, I suppose. But when you talk about the muscle tearing during the exercise so that it can then regenerate and be stronger, is that the roots of that expression, no pain, no gain? You have to cause pain in the muscles to then generate, allow them to regenerate themselves so that you actually become stronger.
Here's the tough thing with that phrase, no pain, no gain. You've got to understand, what are you asking the pain? Are you saying that the pain from injury or pain of like cardiovascular where you feel like you don't have enough energy to continue on? Be sure what that phrase refers to. You don't want to say, I just sprained my ankle. Okay, let's run through it and make that ankle worse and have a not a partial tear, but a complete tear. You've got to make sure that you're just, you're that phrase is kind of like dangerous. I always say you have to listen to your body. Really listen to what you're setting yourself up to. If you're setting yourself up for something like you're a maybe like a 1 mile, 2 mile runner, and then the next day I'm going to push myself and run a marathon, no pain, no gain. Be aware that you haven't built yourself up to that. You want to take these like micro steps, these little victory steps to make sure that you can get to that goal of a marathon. Instead of running 2 miles, go for a third, fourth. Build yourself up. Go with a running coach. Go with a team, and then they can effortlessly move you forward into that goal of running a marathon. So that no pain, no gain. You've got to be very cautious with that, because once you go into that world of pain and injury and maybe a tear, it's hard to recover from that. But when you do work out, you do want these little micro tears, these little breakdown of your tissues, because that's what sends us information. Like, all right, let's get ready for the next event by rebuilding that muscle stronger, bigger, so we can handle that endurance or that walk. So then you slowly build that up, and with that you build up muscle tissue. So that no pain, no gain to me is, you have to really identify what you're asking your body is pain. And then when you identify it, because then I know what pattern to take from that point on.
Yeah, it's almost the way which we describe it at the gym that I go to, which is like pain is bad, but an ache is all right. There's a difference between pain and aching. Aching is something that, yeah, you've exercised, you've pushed yourself because you've got this ache, which you're going to get better from. But a pain stops you, and there's a difference between the two.
Mm-hmm.
Right? And you never have to question the difference between the two. You know the difference between the two. You know when you're in pain, and you know when you ache.
Yeah.
So much of when we need a doctor of any kind, it's about, this never seems to be brought up in conversations. Regenerative medicine, it never seems to be brought up as a topic of a conversation. Why isn't it something that becomes
Yeah.
part of the conversation with our general practitioners?
Okay, so when you look at like these, I guess you guys call them GPs, right? General practitioners. We call them yeah,
Yeah, we do. General practitioners.
we call them like our family doctor or primary care.
Yeah, yes.
I feel that it's expands from, you think about where they're at. They're looking at the present time. They see your serology, your blood work. They see where you're at right now, and they say, all right, we are at the normal range. We're okay. We have a plus or minus of maybe some deviation that allows us to be a little bit of on the light side, a little bit on the heavy side, but we're okay right now. When you go past that point, some primary care or general practitioners, they may look into the future. The problem is it's the maintenance, it's conditioning, it's behavior. Some physicians don't want to put the effort of working with their patients, right? This is beneficial for you in the future. Let's work together, and it's more visitations, more conversations, and more coaching. So when you look at regenerative medicine and then we look at the future of a person, you have to ask what their goals are. Somebody doesn't want that future tense mindset. Some, like myself, I live in the future, and everything I do right now has to be affected the future.
Yeah.
It's a different mindset. So do we all think alike? No. Now I wish that we had more general practitioners that think that way. It's just that the receiver sometimes doesn't have that conscious thought of looking beyond that. They just care about where they're at now, and they don't move forward. So I think that's more educational from, like, I guess you guys call it primary, we call it
Yeah.
elementary. I think that's where it needs to start from.
Mhm.
Really looking at diet, really looking at what is good, what is bad, why are these things antagonizing us, why it's good for us, what is exercising, increase PE or these physical activities in these schools. Teach them how most of these diseases that we get in chronic growth, from diabetes to cardiovascular, is cured by just a simple exercise. Real simple. A primary simple step of just asking your body to do its cardiovascular movements and get that blood flowing.
Yeah.
And then taxing your body. When you tax your body, then you have to recover. And then when you lose that signal, well, then you have to go into regenerative medicine. But continually move, constantly move. Your body enjoys movement. You might not enjoy it during the time, but afterwards, you feel great. You feel like you accomplished something mentally and physically. You feel fatigued, but more so, you feel like you accomplished something. And then the next couple of days, when you recover, you feel like that was an easy task. Let me push myself further. So it's a fun game once you get in this world of longing your desire to go into the push portion of the life, and then finding out that, hey, I feel healthier. And then now, since I'm recovering faster, my outlook in the future is longer. I can see myself in the 90s still being active, traveling around the world, and not being, bedridden or sitting on the porch just staring at the world and saying, I wish I could do this because of my bad behavior. I'm sitting right here. That's the kind of things that I look forward to.
Yeah, I think you've summed up Fit for My Age exactly there. And it has really been very interesting. Thank you very much, Dr. Tommy. I've really enjoyed it, and I've learnt so much. Thank you very much.
Michael, anytime, man. This is a fun little conversation. I hope I didn't confuse you too much, so I try to make sure that it's about educating. It's all about, like, teaching them their anatomy, physiology, what the condition they have, and then how do we go about fixing it.
Yep, precisely. It's a great job. Thank you very much.
All right, Michael.
I am Michael Millward, the Managing Director of Abacida, and in this episode of Fit for My Age, I have been having a conversation with Dr. Tommy Rhee, the author of The Future of Regenerative Medicine. You can find out more about both of us by using the links in the description. At Fit for My Age, our aim is proactive, positive aging. Knowing the risks early is an important part of maintaining good health. That is why we recommend the health assessments available from York Test, especially their annual health test. Their annual health test, performed annually by an experienced phlebotomist who will complete a full blood draw at your home or workplace. The annual health test provides an assessment of 39 different health markers. After hospital standard tests are carried out in a UK AS accredited and CQC compliant laboratory, you will be able to access your easy to understand results and guidance to help you make effective lifestyle changes anytime by your secure personal wellness hub account. As you would expect, there is a link in the description and a discount code. I am sure that you will have enjoyed listening to this episode of Fit for My Age as much as Dr. Tommy and I have enjoyed making it. So please give it a like and download it so that you can listen anytime, anywhere. To make sure you don't miss out on future episodes, please subscribe. You'll probably also want to share this episode with your friends, family and work colleagues as well. Remember, the aim of all the podcasts produced by Abacida is not to tell you what to think, but we do hope to have made you think. Until the next episode of Fit for My Age, thank you for listening and goodbye.